Hello everyone, this is your host Robin Tandel from InnoHealth Magazine Studio. I welcome you to this podcast produced by Innovation Curious with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to Voices of IC Innovator podcast from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite the members of the IC Innovator Club and get to know a little bit about their journey and further discuss their perspective about the club. Today, we are going to have a conversation with Captain Sandhya Shankar Pandey. Welcome, Captain Sandhya, to our podcast. How are you today, ma'am?
I'm good. I'm very well. Thank you.
So, now coming to the podcast, let me elaborate on the flow of this podcast. I would be asking you a series of questions and we may discuss your opinion on it.
Sure. Please go ahead.
Before getting into this podcast, I would like you to tell us a little bit about your career path and your journey up to this point.
Wow. I didn't expect this. Rohan, I'm a professional nurse today, and I started my journey in this career from Army. It was an All India entrance exam where I scored 5th rank and was a privileged cadet to be enrolled for the BSc Nursing program at Armed Forces Medical College and my alma mater. And I went on to serving with military nursing services for almost more than a decade. But I quit at 13 years and landed in the corporate sector. I've worked in multiple profiles and started my journey as training, development, and quality manager. And from Max Healthcare, I've worked with the organizations like Medanta, and currently I'm serving Fortis in the capacity of the nursing head for the group. And it's a network of 28 hospitals. Along with it, parallelly runs is my quality journey to the healthcare. And I'm glad to share that I'm also an NABH assessor. And so that's the duty, I would say, and my service in building and strengthening the healthcare sector across the nation, apart from my current responsibility in the organization. And thirdly, towards my own profession, I hold a role which is just during my off times or my holiday is an Association of Nurse Executives India, where I'm the national executive member, and I'm also the president for the Delhi chapter. And we work towards empowering and capability building and advocacy for the nurses' role in the private sector. That's all about me in a nutshell. I'm glad to be associated and connecting with you today.
That's a great journey, I guess. And I hope that you keep contributing like this. I guess that this kind of contribution would play a vital role in uplifting the society. So now, further talking about career, we have varying experiences at various stages, bringing in various life lessons, of which we think of some of those lessons have taken a long time for realization. It's not a sense of regret, but we feel or say imagine that under some different circumstance, that is, having learned the lesson earlier would have given a smoother flow to our career. So I would like to know that one thing or say one lesson that you wish you knew at the start of your career.
That's a difficult one, Rohan, but you just pushed me to the moment I started, and my day one, I would say, stepped into the cadet mess. And one thing I realized within first 24 hours, it's all about discipline, I would say rather self-discipline, hardships, and commitment. These are only 3 things. I learned it there in the first year. And these are the only 3 things which kept me surviving and kept me going till date. This actually comes in. Self-discipline, hardships, and commitment.
So moving ahead, life is a journey. And to make the most in this journey, we use things or say the resource available to us as stepping stones to grow and develop, to be the ideal personality that we would like to build in our future. Some of those enabling us to take a major leap due to its deep impact on our minds. So my question to you is, what are the resources that had a major influence on you as a professional or as an individual?
Thank you for asking this, because it is it's good, and this is my principle that I attribute my today's existence to especially the gurus and the people who have actually played a critical role in reforming me and helping me evolve in this role today. And when I actually look back, first person I remember is my principal from the purely girls' school among 2,000 girls. and pointing me as an, defaulters in the continuous defaulters in the class, picking me. She knew to channelize energies and she put me in sports. And I evolved to become the house captain for hockey for the district, and of course exploring my career, a short career in track and field. Going forward, I'm actually blessed to be trained by one of the best teachers, instructors, and professors of Indian Army. And that's what I experienced at my alma mater, AFMC. And to name the first one, and the one whom I actually idolize a lot, Major General Elizabeth John. She is retired from the from the apex chair of the military nursing services of Indian Army. But she happened to be our batch program coordinator when she was just a major, and a very young, beautiful professional, and who mentored and carved nursing professionals from the raw girls who came from various backgrounds and states in the country. Command over language and power of communication. There are two things: enriching vocabulary and then going deeper on how to acquire knowledge, but how to acquire that knowledge translate and that knowledge into a presentable form is something, and how to go ahead and commanding your own domain. These were the few things, and she was a lady with zero tolerance and zero space for mistakes and errors, because she would make us do things again and again. Many broke, many left, many just sailed through. And probably she identified a couple of us who knew who were the tough souls, and she relied upon us. And probably that's the reason I feel honored that she still keeps in touch. She's one of my idols. And apart from this have been at the professional front. In the corporate life, I would like to name one person, one of the CEOs, Mr. Rajat Mehta, in my previous organization, who has pushed me into taking diverse roles. I'll talk about it some other time, but diverse roles means leaving completely my domain and venturing into other domain and then coming back. It was about the appetite for taking risk, staying humble under tremendous pressure and in adverse circumstances when nobody's with you, so that your brain works and you take sane decisions. So these are few things at the professional front. And at my personal front, when I say whom I idolize, there are two people: my father and my husband. A tough man. I draw my inspiration because he's hemiplegic today at the age of 82. And he's been in this situation for last 32 years. A very brave soldier from defense, and then getting on to being a disabled person and still bringing up his children, teaching them how to fight for life. The only thing he knew was never to see him. I have never seen him disappointed, and how to always stay charged towards the goal, because he was to kick us. And my husband, who actually always, I would say, pushed towards being out of the league, think out of the box, and doing something which is actually has got an edge towards above the normal. And this is one thing. Sometimes I didn't like, sometimes I liked, but eventually when I reaped onto the benefits, I was thankful to everybody. So these are the few people who have actually played a very important role in paving what am I today.
True, ma'am. Having such mentors and personalities in our life may be a bit bitter at sometimes, but when reaping the benefits that we get from being in touch with them proves to be different. Now, going ahead, talking about careers, many people face various hardships. So I would like to know some of the hardships you faced in your career and how you found inspiration from such situation.
I'll narrate only two experiences here, one from my army life and one from my corporate life, because these had been the game changers in my entire life till date. And first, about the army life, when as a young lieutenant, I have not even completed first year in my life. In my professional service, I was posted in Valley, and the war was setting in, the Kargil war. It is almost set in because the casualties had started to pour in. It was just with 8 months in the station, I was asked by the senior most head of the department, my principal matron, to take over the charge of the ICU, wherein I did not know what an inventory is, how to keep up. And this was about the complete gamut of not only the records, reports, and the meticulousness of data and information. It is about managing those soldiers, managing the inventories, managing stocks, equipments, their treatment, their care paths, everything. An army does not have the luxury of having 1:1 ratio the way we practice in the private sector, or 1:1.5, 1:2, or 1:1.5 in the wards. Nothing like that. It's something you're responsible for the entire piece of work, entire area in the department. And I just took charge. And I was scared. I'm not hesitant in saying that I was very scared. I was scared to death. First thing, I was seeing so many casualties in masses for the first time in life. And I've only heard the war stories from my father before that. And I was seeing so many casualties, so many deaths, people dying in my head. And this was emotion, but practically everybody at your mercy, treatment and managing them. Sailed through, the war got over, and then further the duties got extended to head the trauma section. And in the first year, with not even completing first year in my life, in my professional career, this was actually a game changer which helped me. I was shattered and shaken. I was not shattered. I would say we are not taught. That was not the time to show emotions and weaknesses or cry over it or go back to the boss saying that I can't do it, because we are not taught to that. Just went ahead, took the responsibilities and started taking help. What I learned within a span of 5 to 6 days of taking over, that there was no time to sit and worry. There was no time to sit and get scared. There was no time to care about your fatigue and the inadequacies. There was only one thing: achieve, complete, report, and then again reinvent. So, and go back. And the cycle went on where we forgot even to go back to the mess. And just this wending. But when I looked back at the end of 1 year, I was recommended for the GOC INC commendation card for the work. And on subsequent 26th of January, when it arrived, and my commandant, when he called me to, hand over that award to me, there was only one thing: the pleasure and the joy which I felt that moment. There was no place for those apprehensions and the hardships which went on. And it's worth looking back. Stress thresholds, take charge, you learn to come over it. Your decision making, because whom to preserve first, whom to prioritize. Your foresightedness and planning, your mental planning, your foresightedness in inventories, stocks, and preparedness to receive any emergencies. They used to pour in. And then teamwork. How to keep everybody in a balanced state, being the junior most, what words to be spoken, and keep the senior nursing officers, the doctors, the medical officers, nursing assistants aligned, so that the flow of communication and documentation is complete in the other shifts. Everything, it was an immense learning, which is actually coming till date. When people say, how do you win, people in networking and communicating and aligning them? Probably those were the building blocks in the first year of my career. The second one is, it was in my corporate life when suddenly I was advised that I have good people skill and I should explore one opportunity in knowing people and getting into people function. And I was inspired by the leadership to get into and go for some training in the human resource. I did my program, and qualified in the human resource management from XLRI, and went on to head the fleet of 3,500 nurses in the organization for HR head for the nursing vertical and the clinical vertical. And that was, again, I left my own nursing partners actually said that not to communicate, not to stay connected, because the domain has separated now. And that was the biggest and the most important emotional shock which I got. It is something somebody is abandoned from the family. And I was in a new team where the acceptability was a challenge. I couldn't go back. And then it was a senior position. I was expected to know everything. And so that sailing, and thanks to the CHRO, my boss, and who helped me actually, whom I was comfortable to share my expression, concern, and I just sailed. There was immense learning in that. When I say learnings, believe me, today's scenario in this leadership role, where it is a very difficult journey for any nurse leader to reach. Nurse leaders literally walk a very tough path. That role of, in that 2.5 to 3 years in that role gave me the sense how a business works, how hospitals are run, how people are managed, how processes are driven, how outcomes are measured. Being in the nursing profession, we used to talk and we used to have a lot of grudges towards people don't care about us and so on and so forth. But when I'm actually from the managerial level to the senior manager, or say in the leadership level, when I actually worked in both the domains, I understood. And probably this worked wonders for me, because going back, I was fact driven. It gave me a reason to talk with logic and facts, and the convincing, actually influencing people increased. And this worked very well for me in aligning teams, communicating even to the leadership if there was a need in the department, or even aligning the department if there was an intent and a goal to be set by this thing in a very rationalized way, which worked, and it was a win-win. But this helped me sail through very tough situations, I would say, these 2 moments. But yes, thanks for helping me recall. These have been instrumental.
Yeah, ma'am. I guess treatment and operations is difficult in their own prospects, but being in the environment of war, and you had to provide to the military, people who are getting injured on daily basis, it must have been exhausting. And I can't even imagine that, you would have to,
Yes.
able to be mentally stable and provide all that kind of service to them.
Absolutely. And there was no space for the caregivers to cry or to feel sad, even though your heart, it was torn apart. You cried every day deep in, but it was something like the show must go on. And our hospital, that is the only hospital which actually has won the battle honors, and I'm proud to be serving, as my first posting there, and that too in a very critical phase when the country witnessed this war.
Yeah, ma'am. The military and civilians of this country would be thankful to you for that.
Thank you.
So now moving ahead, we may be liking our professions a lot, but there are always certain professions that intrigues us, not necessarily to make a living out of it, but just a wish to explore and enjoy the journey if time permits. So I would like to know, besides your current profession, what profession would you like to explore?
If I wouldn't have been in army, I would say about the past, only one profession which I actually aspired. If I wouldn't have been in army and in military nursing service, where I came by, it was not by choice, but yes, when I got into it, I loved it. I would have been a civil servant, because I always wanted to become a civil servant. I tried from army, but the passage to go out and appear is a very complicated and time consuming, and I actioned very late. And so that was the past. And today, if I really want to pursue a career apart from nursing, I would like to go into politics. I want to become either, a public chosen figure and to work. But I certainly want to explore a career in politics. And otherwise, I aspire to have something as a startup, as an entrepreneur, especially for nurses in India. I have something in mind. I just see. I'll hope if I'm able to live my dream.
Those are some great aspirations, ma'am. And I feel that people like you would do far better in politics, I guess. The kind of situation that our country is facing due to the lack of personality in that region would improve a lot if people like you would step up more.
Let's see. Thank you.
So coming to the next question, in this fast-paced world, there are many reasons for stress in the daily lives of a person, for which many people find their own ways to relieve it through some activity. So what I would like to know is, by doing what rejuvenates you from your daily workload and stress?
So there are 2 things to it. At work, also, even during the busiest and the craziest day, I get a complete adrenaline shot and my enthusiasm soars, for 2 reasons. If I come to know anywhere in the network and anywhere, My nurses are recognized for the work. Just a simple thing. I was dead tired, talking one of the days. And down south, the hospital and my nursing head informs that a nurse has actually on the road tried resuscitating somebody, and nobody came for help. She had put that person in the auto, brought to the hospital. That is what is the value. Anywhere my nurses get recognized actually fills me with an adrenaline shot immediately. Whatever state, condition, place, time of the day, night I am. And personally, when I come back after the day, anybody from the family who opens the door, there's a tendency, they just come forward and they hug. And it's usually my son who just opens the door. He's very tall, he's 6+. He bends down and always brings his forehead forward for me to kiss him. And that actually, I just love that. And I always hope whenever I enter the door, he should open the door. And I look forward to it. I really feel great. It's just a reason to smile and everything goes, how much ever tired you are.
That's the best stress buster, I feel.
Yeah.
Now moving ahead, I would like to come to IC Innovator Club. Now talking about the club, I would like to ask what it means for you to be a member of the IC Innovator Club.
This has been an actually great opportunity, I would say. And I want to thank VK sir for this. Reason being, he's been one of my mentors in the past, and especially when I came out of army. And in the inspiration who actually pushed me to take challenges and build my capability. So when it comes on to this fleet of experts, the so-called IC Innovator Club, I actually look forward and I'm blessed to be associated because of the network. It's the fleet of intellectuals. And even though when I'm not very active in the group, the type of ideas which float in, the type of suggestions and the recommendations which come during the panel discussions and the various talks which are organized by the club. And thirdly, the most important thing, if you have any doubt, you just float in there and you get so many responses. It's like a menu to pick and choose. And all of them are like undeniable, very good ones. So, and not only that, just going through the discussions and listenings, you too get many ideas. Otherwise, this type of stimulating discussions and trigger, thought-provoking ideas are always very important and a certain role, especially for the leaders or especially for the people who hail and have big teams and large teams and who always have the responsibility to keep their workforce engaged and productive. So such type of ideas are very beautiful. And that's the reason, I'm blessed to be reaping these benefits from the club. And thank you so much to VK sir and to the club for this. I actually enjoy the association.
Now, moving ahead, the definition of innovation may be the same for everyone, but the meaning, the value, or say the inference of this word differs from person to person. So my question to you is, what does innovation mean to you, considering the healthcare industry?
You actually asked thank you for asking this question. I fail to make people understand, or not people, I would say, make myself understand, because my previous understanding used to be innovation means something out of box, coming as a tool, as a device or a gadget. And that's what people are going to use and then say, wow. It was in this role, for last decade when I started exploring and, trying out new things. I eventually learned that innovation is not about a gadget, device, opportunity, tool, anything. It is about any new transforming way. And this is what is true for healthcare. It is a new way for anything which is actually requiring less effort, less cost, and more outcome. And now this, whether it is translated into the form of a format or a document, whether it is a revamping and remodeling of a process, whether it is about re-engineering of a program, whether it is about designing a new tool to measure the outcomes, or whether it is about a new device or a solution which is brought to the people and the caregivers. And so innovation is about anything which actually makes your life easy, better than what it was before, right? It's an evolved solution, I would say. It's an evolved solution. And in healthcare, it has actually proven so true during these COVID times. When as a country, I would say infrastructurally, process-wise, resource-wise, we were not that ready. We were not ready, but we were not that adequate. And mainly the processes and the people. And that's where probably if somebody, and we went on to creating a repository, but if somebody dives into that field and those times, will find the phenomenal and the amazing innovations which has come in, starting from even scheduling the people for the duties, or communicating to the patients and their relatives from the areas where nobody knew and nobody was permitted to go, aligning the flow of medicines, food, and supplies to the nurses and to the recipient, that is the patients, with minimum of resources where nobody was available, and of course keeping the other people happy, safe, and infection free, those who are visiting the hospitals as well as the other people who were working in the hospital. So because the COVID and non-COVID works went simultaneously, and these are the things which are worth diving and researching into, on how did the innovations took place, which people didn't even realize, and how the show went on. And we came successfully on it. We emerged successfully. This is what actually innovation, I would say, from my perspective, when I view it for healthcare, I call it as.
That's a great perspective, ma'am. So for my final question, I would like to ask, where can our listeners connect to you?
My listeners can connect me at LinkedIn, at Facebook, through email. I'm available at all these. I'm not a frequent visitor for the social media. A phone call or a email is good for me. Otherwise, LinkedIn and Facebook. I'm there at LinkedIn and Facebook as well.
The link to connect with our guest speaker, Captain Sandhya, will be down in the description. Before concluding, I would like to thank Captain Sandhya Shankar Pandey for joining us on the podcast. Thank you, ma'am, for giving us the time and sharing your experiences and views with us. It was a pleasure to have a conversation with you. Thank you, ma'am.
Thank you, Rohan, and thank you, IC Innovators Club. Thank you very much for the opportunity.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. If you have a healthcare innovation journey of your own to be a part of our podcast, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Robin Tandel from InnoHealth Magazine Studio. Thank you.